Today we have Dr. Rues with us. She's a naturopathic doctor with Kansas City Integrative Health. Thank you for coming on the show.
Thanks for having me.
If you'd like, give us a little background for yourself, and we'll jump into the coronavirus after that.
I am a naturopathic doctor. I have owned and I've been practicing in the Kansas City area for over 5 years at this point. Prior to that, I went to medical school, naturopathic medical school in Phoenix, Arizona. And before that, I had my undergrad degrees in molecular biology and psychology from Rutgers University here. So my practice primarily focuses on women's health and fertility, which is interesting in the light of coronavirus because I've been quite nervous for my pregnant and fertility-seeking patients during this whole process.
I imagine they've been reaching out then?
Yes, in multitudes.
Yes. Your expertise, medicine, what do you know? What do we know right now? With the coronavirus, with COVID-19, right, because coronavirus is a family of viruses, and this is a specific strain of coronavirus, hence why it has its own name. This COVID-19 is completely unknown. I mean, the scariest part about coronavirus, or COVID-19, which I will use interchangeably, is that we just have no idea what to expect. It's less than 6 months old in terms of a virus. And what is probably scariest is we don't know how it affects people short term as much. And then in terms of long term, what are the long term ramifications? What happens if it mutates and comes around again? There's a lot of unknown aspects. And once we have more time, I think things will probably slow down. And really the knowledge of what we know will help so much in terms of not only small business, but medicine and probably even the economy. So I know the three of us were talking. One of our questions we kind of have is like, are people or are people not overreacting? Kind of what's your perspective?
I think it's better to be prepared for the worst and hope for the best. I'm hoping that every hysterical media outpost is completely and totally wrong. But some of the news that comes out of China and more importantly, and recently Italy is pretty scary. And not so much that the death rate is high. The death rate is relatively low. It's 3%, give or take, depending on what math you use and how many people are testing. That is about 3 to 100 times higher than the flu virus, which is a pretty wide range because we just don't know. The more worrisome aspect is that generally in Italy, about 10% of patients are needing ICU treatments. Doesn't matter of age. So if you look at it from that perspective, the massive amount of ventilators and CPAPs and other types of and BiPAPs that people need in order to survive this is independent of age for the most part. And we don't have enough supplies in the US or in the world if everyone gets this tomorrow.
So this is where kind of we've seen people talking more about we could have a higher or lower fatality rate practically just based on how many people get sick at the same time.
Correct.
Which is why they're canceling everything.
Yes.
So I think sometimes that's been lost in the media so far as they're not canceling everything because it's so deadly. They're canceling
Correct.
everything because it can be deadly if we don't have enough people to care for the people who get sick.
Yeah, people and equipment.
Yeah.
Just on a basic level, how does a new strand become available?
Well, so from my understanding, and let me preface this that I am not an infectious disease expert. Like I said, the coronavirus, it's a family of viruses that's actually pretty well studied. And I mean, there's a good chance that you have had a coronavirus cold in the past in your life. What happens is it jumped species, and we don't know exactly which species it came from, but it's highly suspected that it came from an exotic species from China. Likely it caused a cold, for example, in this animal. And then when some human consumed it, for some reason, it had the ability to infect that human. And then with that, it has never infected any other human before. So now it's creating this kind of rampage where it's being able to be transmitted human to human.
So do we have like 19 of these? Or
19.
I think somebody told me COVID-19.
I think it's because of 2019.
2019, right?
Yes.
Okay. So do you have, off the top of your head, do you have any idea how many strains that we're aware of? Because obviously
No idea.
They're already saying that there might have been more strains of the COVID-19, and they're still like trying to figure out how many of COVID-19s already exist.
Right. No, there's always a possibility for something to mutate and change. For example, I know that we've been vaccinating cows for coronavirus for, tens of decades at this point, but it's not enough of a match to the current COVID that it could just easily transmit into humans because there's so many different types. If you just consider the influenza, they have 3 types of flu in each year's vaccine because it mutates so quickly over the span of even a year that they're trying to hit what they think is going to be the most likely strains that cause issues. So that's how they approach it, because there's, H1N1, which everyone's heard of, but then you could have, H2N1, there's so many different combinations, and each combination requires a different vaccine. So the same thing with coronavirus, each strain could potentially require a different vaccine.
So what can people be doing right now? You have your own unique perspective to it as a naturopathic doctor, which I'm sure people are very curious on. We know to wash our hands.
Right.
We know that we don't know how it's transmitting. The news has been pretty popular. We know they're worried about obviously breathing it in when you're in the room. Mm-hmm. But what are things we can be doing to defend ourselves?
Well, as a disease, it doesn't seem to be generally terrible. It's just statistically, if you're in that 10% or more, then it's going to be pretty unfortunate. But in general, if you are not an at-risk individual, you're younger, you're healthy, there's no pre-existing conditions, it'll probably just be like a flu, like probably one of the worst flus you've ever had, but flu, cough, fever, body aches, maybe mild pneumonia. That's kind of common in even mild cases, but it's not necessarily going to completely disrupt you and your health in your life. So generally, most Americans will be fine. The concern is that if you are exposed to anyone who isn't in that just going to be okay risk, like someone elderly, someone with kidney disease, diabetes, hypertension, cardiovascular disease, or pregnant. Those are for the most part, the patients that are presenting as the most problematic.
So if you're those patients or any patients, would you be suggesting any supplements? Are you suggesting, what are you telling people when they say, hey, what can I do? Should I be wearing a mask? Should I stay inside?
Well, if you have lung disease at this point, I would say yes. Absolutely. Why not wear a mask? If you are any of the other ones, I would highly consider some sort of self-quarantining, even if it just means minor quarantine. Don't go to major events. Make sure you're staying at least 4 feet away from anyone that could possibly be sick, if not all individuals. Mm-hmm. Trying to minimize contact, not only with individuals, but places that have a high amount of germ contamination. The grocery store, you want to watch out for, carts, just doorknobs, little things along those lines, and making sure that you are taking just preventive precautions so that you aren't exposed to the virus, even if, you happen to be in the same room as the virus.
So it's not an overreaction to be wearing gloves when you go to the grocery store and kind of throw them away on your way out.
I wouldn't say so, not necessarily, but it's just as effective to wash your hands really well. So there's no reason to splurge on gloves. Fascinating, the coronavirus, it's covered in a fatty membrane on the outside. And so the best thing to break up a fatty bilayer is soap. Alcohol, yes, but soap and water is probably the most effective thing that you could do.
Awesome.
Yeah.
That's encouraging.
Yeah.
I no longer feel the need to wear gloves. I'd rather wash my hands when I was done anyways.
Yes. Wash your hands. Don't touch your face. Don't touch your lips. Don't pick your nose.
That's kind of a given.
Yeah,
I've heard, obviously, from the statistics that particularly kids have not shown much sign of being affected by this. Is that true, or what have you heard about in regards to?
Yes, that's absolutely true. So kids have been shown to have mild cases, which kind of present just like a regular common cold coronavirus, which is great on one side because the kids are seemingly not affected. You're not going to necessarily have a high child mortality rate.
I heard there was none even under the age of 9.
I don't know of any documented cases under the age of 9, correct? And there have been a few cases where a pregnant woman has transmitted it to a newborn, and the newborn was absolutely fine too and had full recovery. So that's great. On the flip side, if they're just having a sniffly nose, you don't think much of it, and you still go to grandma's house.
They're infecting others.
They're infecting others. Mm-hmm.
Some of the fear is more of the unknown. If it doesn't mutate and this is as bad as it gets, that'll almost be a relief.
Yes.
It's the mutation. And then what if it starts targeting other groups of people that kind of creates this additional unknown, like fear factor?
Not just a mutation, but a concern is that you could get it twice, which is not common for most infections because
if it mutates, you could get it twice.
Yes. Yeah. Yes. If it mutates at all. And there are some theories that even without mutation or the minor mutations that people have, or that has already happened, people have gotten it twice, which is causing more probably nervousness, I think, than even the initial infection, partly because if it mutates, there's a worry of something called a cytokine storm, where you have a normal immune reaction the first time you're exposed to it. And even people are being exposed the first time. Some people are having an abnormal reaction the first time, but higher likelihood even with a second exposure where your immune system overreacts and creates inflammation. And anytime you have inflammation, you can have fluid buildup, right? If you say you imagine you sprain your ankle, but this is of course not affecting your ankle. This is affecting the lower lobes of your lungs. So if you have too much inflammation and fluid buildup, you could potentially have a really debilitating or morbid pneumonia.
Interesting. So that's what I've heard people use the term, and I'm like, whatever that means. A storm.
Yeah.
Okay. I mean,
it's overreaction, over inflammation.
It's like when IT people say a data storm. I'm like, okay, stuff went wrong.
Right.
But that actually makes sense.
Yep.
At what point would you then contact your doctor or make an appointment if you see some symptoms, but they're not severe or
the type of symptoms?
Or the type of symptom?
Yes. I think one of the unfortunate parts of just general response, especially in the U.S., is lack of testing, which kind of worries me because they haven't had clear guidelines from the CDC on who gets tested. And I'm sure you can hear of reports where individuals were possibly exposed, but because they didn't meet the CDC strict guidelines, they weren't tested. And they likely didn't self-quarantine and were continuing to spread this virus. So in general, I think at this point, things are slowly starting to change with testing, because I have heard and I've seen reports from major laboratory nationwide corporations showing that they are offering COVID-19 testing. However, I don't see that it's quite widely available. If you have symptoms and they've requested and they've asked doctors to request and communicate to patients that you don't go to your doctor's office, you actually call ahead so that they are prepared for the possibility of putting you in isolation so you're not exposing any other patients further or the medical staff. If you're going to go to the ER, same thing, you call ahead if your symptoms are that bad so that they're aware. Typically, the hard part is the flu was pretty bad this year and it was going around, and it still is going around. So it's hard to know if your current symptoms are related to the flu or if they're related to COVID-19. So one of the things that you definitely just want to be conscious of is who have you been around, and has anyone else around you been sick, been traveling, or anything along those lines. Unfortunately, as community spread becomes
more rampant, it'll be hard to tell if you've been exposed and which ones you've been exposed to.
So if I get sick tomorrow and I decide to self-quarantine because that's the right thing to do, how long do I self-quarantine? When symptoms stop, like when can I go back to resuming my life?
The current guidelines, if you're exposed, you're supposed to wait 14 days until you can go back to your life. So that's
14 days is just if I'm exposed.
That's just a known exposure.
Symptoms.
Correct. Known exposure.
Okay, so then I start developing symptoms.
If you develop symptoms, the standard is 14 days, again, from exposure, or 3 days after symptoms subside, whichever's longer.
Okay.
Personally,
minimum 14 days.
Personally, I don't know if that's long enough. They just came out with a study where someone was shedding coronavirus for 36 days.
So in my scenario where I can do a lot of my work from home.
Right.
I mean, maybe I go 21 days.
Yeah.
It's only fair to those who work with me.
Yes. I don't think they have an exact answer, but those are the current guidelines.
Okay. So where's the jump? How do I know like this is just the worst flu I've ever had or go to the ICU?
Right. So the things that are most important to watch for are vital signs as much as you can. Now, I know everyone doesn't have an oxygen saturation monitor at home, but if you happen to have one, that's one of the things you want to watch. If you have the ability to check your fever, that most people have a thermometer at home. So if your fever is dangerously high and not able to maintain...
What's dangerous?
For adults, it's usually around 101, 102. But in kids, it can be higher.
Okay. So that's what I thought. 101, you start to know, hey,
yes,
start watching it.
Especially if your fever is not being suppressed with antipyretics like Tylenol or ibuprofen. And if you're probably the most worrisome sign that you're looking for is shortness of breath. If you feel like you can't catch your breath, you're not breathing, you're not getting enough
lungs.
Yes, you're not getting enough oxygen. The concern is that it's developed into pneumonia and you don't have enough oxygen transfer to the blood.
Okay, so that's why you said an oxygen monitor would be really useful because it's telling you, even if you feel short of breath, you know how much oxygen you're getting.
And a lot of people have blood pressure monitors at home. If you do, that's another good sign to monitor. If it goes way too high or way too low, not a bad idea and you have symptoms of the flu or COVID, then not a bad idea to go in.
So, Dr. Rues, you introduced that you were also a small business owner. How is this going to affect your business? How is this affecting your conversations and plans?
Yes, it's definitely worrisome for multitude of reasons. I feel very blessed with my practice, such that I'm practicing more women's medicine and chronic disease management. So a lot of my visits will likely turn into telemedicine in the near future, which is nice because I have that convenience option. Unfortunately, that does make it so that I cannot do a physical exam or any procedures with a patient. However, they can still have health treatments and care, and we'll be using a lot of use of, drop shipments for anything that has to be shipped to the patient for their treatments. But I've been very blessed to have business guidance so that I have a nice fund that I was hoping to use on renovations or some other business development in the future. But this will likely turn into an emergency reserve fund for any bills that will pop up so that I can maintain and outride this course. Concerns that we have are for patients and patients' care so that they're doing well through this time and they still continue to get the best care. But as the market does possibly downturn and patients become more tight with finances, that may, of course, affect what they're willing to do in terms of their chronic disease management. They can, people could decide to let their, painful periods or diabetes or something just be put on the back burner while they're in isolation and this blows over. So
yeah, that's a great point because it's not really just about can you treat the patients. It's also about will your patients have the funds to pay for the care around the corner too? Because obviously it's affecting a lot of people.
Yeah, there's a lot of people who hopefully they don't struggle, but there's a concern for a lot of people financially struggling through this.
So advice then for other small business owners, obviously, is this the first time in your 5 years that you've kind of benefited from this experience and feeling of like, oh, this is why this money was set aside. This is the first time that you're like, wow, I still sleep easy now.
Right. Yes, absolutely. As much as you can, minimize expenses and make sure you're saving as much as you can for this wave to ride through. Because even though it's going to be a rough transition, I do think that this will normalize with treatments or a vaccine or just becoming part of the yearly like flu or viruses that come around. I don't think that this wave is going to necessarily last forever. It's just going to be rocky while it does.
I often say this too shall pass.
Yes.
Great advice. Same advice we have for the individual. Always best to have an emergency fund of 3 to 6 months.
Yep.
Thank you very much for being on the show.
Thank you so much for having me. I appreciate it.
That was great.